And amid the recovery efforts in Texas, Americares is working to address health needs for survivors and first responders. The group's helping to restore healthcare services and provide medical supplies in the flood zone. The head of Americares emergency response team, Jack O'Rourke, is here now to tell us how that effort's going. Jack, I know it's a busy time, so thanks for joining us. What sticks out to you from what you're seeing in Kerr County right now?
Yeah, thanks again for having us. And first of all, I want to say that our hearts really do go out to everyone facing this unimaginable loss and uncertainty in the wake of this devastating flooding in Central Texas. And us as Americares, we're really committed to helping in any way we can. Americares is a health-focused relief organization. We have 45 years of experience responding to emergencies all over the world. And right now, our focus is really on supporting the displaced families and ensuring that the survivors have access to the care that they need during this difficult time. I think, as we've seen, the focus has rightfully been on search and rescue, but in the coming days, we're going to see more and more health needs emerge, from people who have lost their medications to displaced people who need access to hygiene kits and to other sort of essential supplies. And so as Americares, really what we're trying to do here is working with our local partners and local clinics, as well as the national and state partners that we have, is working to mobilize the urgently needed medical supplies, support frontline health workers, and really to ensure that the survivors have access to essential care.
What do people there need most right now?
Yeah, so I think right now what we're doing is just in terms of coordination with the local partners is there's the need for example, people who have lost medications in floods, but also we're also in conversation with our partners, hearing some of the longer term and medium term effects of this that are going to arise in the next couple of days. And one of the things that will be significant, we can measure will be significant, will be mental health and psychosocial needs. And that's one of the things that, I'm here with some of our mental health experts and team to kind of focus on those mental health needs and work with local community partners to see how we can best respond to both the immediate needs of survivors, but also some of the medium and longer term needs arising from this.
So how do you deal with those long-term needs, especially when it comes to mental health ramifications of an event like this?
Definitely. Well, I think it's very important when we're doing this assessment and working with local partners to hear from them and to hear both the immediate needs, but then, on those long-term needs, we can hear in terms of their experiences, but then also a lot of our experiences as Americares. Again, we are an organization that has a lot of expertise in mental health work across 45 years. We've worked in various natural disasters, hurricanes, floods across the country. And that's something that we're trying to draw on that expertise to hear from our partners and hear what's the best way for us to possibly respond.
So how can people help support your work there?
Definitely. So I think the best way for people to support our work is to go to americares.org and contribute in any way that they can.
Jack O'Rourke with Americares. We appreciate it. Thank you.
Thank you.